Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the markers of active disease in rheumatoid arthritis? In rheumatoid arthritis the markers of active disease are anemia of chronic disease will tell us that there is active disease going on. There can be increased erythrocyte sedimentation rate, increased C-reactive protein, increased platelet count, and also decreased synovial fluid viscosity. Decreased synovial fluid viscosity. All these are the markers of active disease in rheumatoid arthritis.
thank you and thank you for watching.